Who doesn't admire a hero? We cheer on professional athletes, especially when they're on the home team. In our society, they are the winners in life. Odds are that they could suffer from a disease that is usually whispered about instead of talked about openly. That disease is mental illness. The truth is, mental illness comes in all shapes and sizes. It also impacts far more people than you might imagine. According to the recent U.S. Surgeon General's report, 1 in 5 children and adults currently have some type of mental illness. One thing to understand about mental illness, it does not recognize socioeconomic, educational, or cultural boundaries. Mental illness does not discriminate. Unfortunately, some people do. Fortunately, in our community, there is a place where people of all ages can go to get the help and support they need to lead healthy, productive, independent lives. That place is called simply Mental Healthcare, Inc. With all the talk about mental illness and related terms, many people still don't understand what it is. Mental illness is any disease or condition affecting the brain that influences the way a person thinks, feels, behaves, or relates to others and to his or her surroundings. The sad reality is that there is still a real stigma to mental illness. In Hillsborough County, however, there is a place where they can turn. Mental Healthcare, Inc. began with a group of concerned citizens who were searching for ways to address the mental health needs of our community's children. Drawing upon the support of the Junior League and other local organizations, businesses, and individuals, the Guidance Center of Hillsborough County was born in 1949. From its small beginnings, the organization evolved into an innovative, nationally recognized mental health organization. Satellite operations were also opened, as was a special school for children. During the 1980s, the agency was designated as Hillsborough County's official Baker Act receiving facility for individuals in need of crisis intervention services. To reflect its comprehensive mission, the agency changed its name to Mental Healthcare, Inc. in 1990. While its name has changed, one thing has remained constant: its goals. MHC has set a high standard to provide the best mental health care available in settings that are the least restrictive to the people it serves. Today, mental health care offers clients a vast array of specialized programs focusing on 4 main types of care: crisis intervention, education, treatment, and community outreach. Client visits and contacts average over 270,000 a year. Our programs are designed to meet the needs of individuals of all ages. Mental Health Care Children's Services offer 20 programs for children in need. We know that when a child or teenager is disturbed, depressed, violent, or a victim of abuse or trauma, it affects everyone in their world. Our first step is to identify, evaluate, and treat the problems as soon as possible, and then tailor outpatient, school-based, or home-based treatment programs that help the child and family. For children and teens at risk of harming themselves and others, Children's Crisis Services offer care and hope. The earlier the child is diagnosed and treated, the better the outcome. The Early Childhood Enrichment Project focuses on early prevention and/or intervention for children from birth to age 5. For Marisol's family, this program has been a real lifesaver.
It's a program that works. I'm glad that we lived in this county and that we were able to get these services, because I think it's made a tremendous difference in her ability to be her own little person, which she was afraid to be. I think the earlier you start with a child when there's something there, the better it is for them in the long run. So I think that working with the intervention at a young age is a wonderful thing.
MHC provides short-term crisis support and case management services targeting children at risk of experiencing further behavioral or mental health crisis if not closely monitored. For Laura, this program provided just the right ticket for her son and for her.
When the caseworker came, she showed how she could turn him on, turn him off, turn him on, turn him off. He'd literally have a tantrum at 10 years old in front of her, cursing at her, doing whatever he could. And through the work with her, she gave us the tools to be able to control him. Just through little bitty changes here and there, we can help him better.
Laura can now also focus on other aspects of her life. In fact, her school recently honored her as Teacher of the Year. Some students are not able to attend public school, and for them, the Mendez School and East Henry Academy are just the right fit. These schools are fully accredited and serve students from pre-K to 12th grade. They offer students mental health therapy and support services, including individual and group counseling and parent education.
We work with children of all ages at Mental Health Care. I work with youngsters who are ages 3 and 4 and 5 in a preschool and program. I also work with elementary and middle and high school kids. We provide therapy services throughout Hillsborough County in our full-time classrooms. We work with the youngsters as well as their families. We go in their home providing them with therapy. We also offer them psychiatric consultation and work with them in small group settings to help them learn peer relationships and work together as they would in any kind of regular school setting.
Sometimes it's necessary to deliver effective intervention for children and adults at risk of harming themselves or others. Mental health care is the Baker Act facility for Hillsborough County, designated by the State Department of Children and Families. The experienced mobile crisis response team is on call 24 hours a day, prepared to handle any type of crisis situation, traveling wherever emergency care is needed in situations involving family members, co-workers, and the community.
Mobile crisis provides us the ability to go out into the community where people live, to see people in their natural environment, to get information about an individual in the places where they live. The idea there is to keep people, if at all possible, in the community by providing them services or linking them up with the necessary services. In the event that that person cannot be safely maintained in the community, then they come here to this hospital. We see over 500 people a month for emergency assessment for psychiatric crisis. The mobile crisis team sees over 100 people a month. So there's 600 people a month that are served just by this building. I think that we do a good job with the resources that we have. It's never enough, of course.
Mental health care has the professionals to effectively handle these traumatic situations, with more than 90 beds available if the person in need requires intensive care in a safe, secure environment to avoid injury to himself, herself, or to others. 14 of these beds are for children, the only unit in Hillsborough County for children in crisis. Children are a special focus of mental health care. The Children's Crisis Services provides emergency psychiatric evaluation and treatment to children who experience severe emotional or behavioral problems. One program offered by Children's Crisis Services is Winning at Parenting, which has made a big difference for some families who have participated. Adults in Hillsborough County are offered a broad range of behavioral health services that enable them to improve the quality of their lives. Participants have an opportunity to dream and to see their dreams come true. Brenda, who now actually works for mental health care part-time in the janitorial department, came up with the idea for a car wash and was encouraged to implement her idea.
I was a consumer here before I began to work for MHC. I've been to a lot of mental health facilities. I've been through a lot. Anybody really wants some help, they can come to this place. They take time and they sit down and they talk to you. They take time and they explain things to you. MHC, I love it. And I love the people that I work with. I love the people that I work with. They love me too.
A combination of programmatic support and counseling enables program participants to develop self-esteem and, in many cases, skills they never knew they had. The innovative expressive arts program actually teaches quilt making and so much more.
And I've learned to do stuff in here that I couldn't do before, like sewing. Now I'm making quilts right and left. I'm really surprised that I've done them.
They form as a group. They develop the interactions and relationships with each other. And they have an opportunity to discuss the problems that they may be having as a group, and it gives them an opportunity to converse with each other. It teaches them some skills that they didn't know how to do, and it gives them a lot of self-confidence because they've accomplished a skill.
I didn't have much self-esteem to start with, and it's just boosted me up. I don't know what I do without it. I really don't. I just love it.
One former art student who came to mental health care when he was homeless is now a proud craftsman at Norris Antiques and Restoration.
I was at a very low point in my life. I was 2 years, I was roaming, homeless. And
he, I think, was at a point in his life that he needed something that meant something to him.
I always dabbled in drawing, but I never considered it a talent.
He has all the ingredients for a master craftsperson. I show him, I tell him, I explain to him why and how, and he understands that.
It's very fulfilling. It's like restoring life into something that is in a downward trend, like I was. I'm
encouraged by him. It makes me feel good that he's come to me and we found each other, because it works. It works for us both.
It's a very worthwhile program. I don't think I can say enough good about it.
At mental health care, individuals learn how to maximize their quality of life, to live independently, and improve their functional skills, aided by case managers who act as helpers, service brokers, and advocates, and job coaches when clients are ready to participate in the work-ready and supported employment programs. The linkage between the full array of programs offered by mental health care is the key to how and why it works. For people who find themselves homeless, MHC offers a safe place, emergency, overnight housing, and a low-stress environment.
We have case management services. We have nurses on site. We do 3 meals a day and snacks. We have substance abuse counseling. We have co-occurring therapists on site. Pretty much all of their needs are met while they stay here.
They get support and, most important, hope for a better future. For Melissa, a safe place was just what she needed.
I've been in different community mental health centers, and this is the most help that I've gotten, the most help that I've narrowed it down to how to do it, what kind of plan we have, work together, let's do it this way, and it's been the most help. So for me, it's a lot of gratitude towards the place.
Mental health care also offers residential treatment and supported housing, including assisted living for elderly individuals, transitional living for individuals at risk, and supported independent living for people with severe and persistent mental illness to live independently with minimal support. To serve this community even better, a group of concerned citizens recently created the Mental Health Care Foundation to support the work of Mental Health Care, Inc. and create greater awareness of its mission. With the services it offers, Mental Health Care, Inc. is indeed a lifeline in our community. But awareness and acceptance of mental illness still remain a challenge.
Remember, mental illness does not discriminate. It affects people of all ages and incomes, children younger than these preschoolers, and older adults. So don't you discriminate against mental illness. If you or someone you know has a mental illness, please seek help. For Mental Health Care, Inc., I'm Gail Searens.